There are 3 stages during the injury process. The first of these being the inflammatory phase. Inflammation is the body's natural response to a traumatic injury. During this stage, pain, swelling, redness, heat, and loss of function can occur. The inflammation phase starts out by a cut or injury which damages the tissues and the blood vessels, allowing for bleeding to happen and pathogens to get in the area. Vasoconstriction occurs for a short amount of time after the injury. Then vasodilation happens, which releases chemical mediators and has temporary local hyperemia. This phase is known as the complement phase. Since all the blood is rushing to the injured site, temperature increases, causing heat and redness to the area. After the chemical reaction happens, capillaries become permeable. Leukocytes and macrophages migrate through the bloodstream and destroy bacteria or foreign cells that get into the body. This is also known as phagocytosis. Margination transpires leukocytes to cling to capillary walls. Macrophages then release cytokines which stimulate endothelial cells. Endothelial cells then express specific receptors called selectins. Selectins serve to grab hold to the carbohydrates on the surface of neutrophils to slow them down in the bloodstream. Bradykinin then comes in and helps to loosen the tight junction of the endothelial cells to let neutrophils through to help destroy dead tissue and foreign objects in the body. Once neutrophils are released through the endothelial cells, they attract mast cells. Mast cells live outside the vessel and release histamine, which further loosens endothelial junction. When the junction is loosened, protein-rich fluid leaks into the tissue space, which causes swelling, which is one of the cardinal signs of inflammation. Pain with swelling is caused by the prostaglandins, stimulating the nerve endings, and that is what sends the signal that causes pain. The second stage is the proliferation phase. The proliferation phase can last for a couple weeks, depending on the severity of the injury. In this phase, granulation tissue forms at the site to enhance healing. The amount of granulation tissue and scar tissue deposited depends on the amount of tissue loss. This is also known as primary or secondary intention. Primary intention is minimal granulation and scar tissue. Secondary intention is an increased amount of granulation tissue and a substantial amount of scar tissue formation. Once granulation tissue forms, it breaks down the fibrin clot. Granulation tissue is made up of fibroblasts, collagen, and capillaries. Angiogenesis will also begin, which is the formation of new capillaries. As the capillaries continue to grow, fibroblasts accumulate and arrange themselves parallel to capillaries. The fibroblast cells synthesize an extracellular matrix, which house collagen, elastin, and ground substance that contain proteoglycans, which are located in surrounding tissue. This particular collagen supports hair, nails, muscles, tendons, and ligaments. There will also be a decrease in type 3 and an increase in type 1 as it strengthens and heals. It provides structure and strength. Granulation tissue will set and produce oxygen for skin to grow back and slowly heal. The third and final phase is the maturation phase. The maturation phase is the conclusion of the proliferation phase, and it cleans up the area and enhances the repair. This phase can last up to many years. Since there was so much rebuilding of collagen, fibroblasts, and capillaries, these things are now reduced. Type 1 collagen continues to increase, replacing type 3 because this phase is all about increasing the strength of the injured area. Since tons of collagen is building up, movement and stress needs to take place in order for the fibers to run correctly and get the best range of motion.